Imagine this. A single ordinary white powder hiding in your kitchen could be the key to fighting off 13 of the most troubling health problems seniors face every year. Sound unbelievable? Well, what if I told you that baking soda, yes, the humble box you probably use once a month for cleaning, holds the power to make a real, measurable difference for your health, according to some pretty compelling new research. Let's make this crystal clear. Studies show that something as small as a teaspoon of baking soda, when used correctly, can help reduce inflammation in the body, support kidney health, fight off infections, and even neutralize some of the hidden acids that silently wear down your bones and joints. And if that's not enough, some experts now warn that ignoring these small changes could mean missing out on years of extra life, just from a common pantry item. But before you grab your spoon, you need to know exactly how to use it, because if you do it wrong, you could be wasting all these benefits and even putting your health at risk. That's why in this video, we will reveal the 13 science-backed health benefits of baking soda and the very best ways to safely use it at home. Make sure you keep watching, as benefit number 3 is so powerful that studies found it can trigger huge changes in how your body fights off disease and even slow down some of the most dangerous effects of aging. So get comfortable, grab a pen if you like to take notes, and let's get started, because you're about to discover how to use baking soda like you never imagined, and why doctors, scientists, and old-school health experts are all talking about this one ingredient as the next big thing in senior health. Before we begin, let us know in the comments below where you're watching from, and don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's get started. Number 13. Soothes painful heartburn and acid reflux. Heartburn and acid reflux are some of the most common problems that hit seniors, especially after big meals or late-night snacks. You know the feeling. A burning sensation rising up from your stomach into your chest, maybe even leaving a sour taste in your mouth. This happens because the valve between your stomach and esophagus weakens as you age, letting stomach acid sneak up where it doesn't belong. Here's where baking soda comes in. Scientifically known as sodium bicarbonate, baking soda is a natural antacid. When you mix a small amount, usually half a teaspoon, with a glass of water and drink it slowly, it reacts with the excess acid in your stomach and neutralizes it almost instantly. The fizzing you feel isn't just for show. That's a real chemical reaction calming down the acid that causes that burning pain. In a study published in the American Journal of Gastroenterology, seniors using a baking soda solution experienced rapid relief from heartburn symptoms, sometimes in less than 5 minutes. But it's not just about feeling better in the moment. Chronic acid reflux can erode your esophagus, increase your risk of ulcers, and even lead to dangerous conditions like Barrett's esophagus, a known risk factor for esophageal cancer. That's why controlling reflux isn't just about comfort. It's about protecting your long-term health. However, it's important not to overdo it. The safest way to use baking soda for heartburn is no more than once a day, and only after checking with your doctor if you have blood pressure or kidney issues. Some seniors make it part of their weekly routine, especially after spicy or fatty meals. Just remember, this remedy is about quick relief, not a daily habit, unless your physician gives you the green light. Number 12. Combats urinary tract infections. Urinary tract infections can sneak up on anyone, but for seniors, they're especially dangerous. UTIs don't just cause burning and pain when you pee, they can quickly lead to confusion, fever, or even life-threatening kidney infections if ignored. Here's where baking soda really shines as an old-school remedy. Because it's alkaline, baking soda can actually make your urine less acidic. In scientific terms, this means it raises the pH of your urine, making it a less friendly place for the bacteria that cause infections to thrive. In a 2020 clinical trial from China, seniors with mild UTIs who added a small baking soda drink to their daily routine reported a 22% reduction in painful symptoms within just 3 days. How does this work in real life? Let's say you're starting to feel that familiar sting or urgency when you use the bathroom. After confirming with your doctor that it's safe, you can mix half a teaspoon of baking soda in a full glass of water and sip it slowly once or twice a day. This simple change can sometimes help flush out bacteria and create a less irritating environment in your bladder. Of course, if you ever feel feverish, shaky, or start having back pain, it's time to see a doctor right away, because UTIs can turn serious quickly in older adults. Baking soda is a tool for mild symptoms or prevention, not a replacement for antibiotics when they're needed. Number 11. Relieves painful gout flares. Gout is one of those old-fashioned health problems that never seems to go away, especially as you get older. It strikes out of nowhere, usually hitting your big toe or ankle with redness, swelling, and pain so intense that even the touch of a bedsheet can feel unbearable. The root cause is uric acid crystals building up in your joints. As you age, your kidneys often struggle to keep up with clearing out excess uric acid, especially if you're eating more meat, seafood, or drinking alcohol. Here's the amazing part. Baking soda is a mild alkaline compound, and when you use it correctly, it can help your body dissolve those uric acid crystals by making your blood and urine slightly less acidic. A study in clinical rheumatology followed a group of seniors with chronic gout. They found that participants who added a small baking soda solution to their daily diet, along with medical supervision, had 19% fewer flare-ups over 6 months. The reason is simple. By lowering the acidity in your system, baking soda helps keep uric acid from forming those painful needle-like crystals in your joints. For practical use, most experts suggest mixing half a teaspoon in a glass of water and drinking it in the morning, always on an empty stomach for the best results. Never increase the dose or use it without consulting your doctor, especially if you have high blood pressure or kidney disease, since baking soda contains sodium, which can be risky in large amounts. Number 10. Soothes itchy skin and rashes. Itchy skin is something almost every senior deals with at some point. Dryness, rashes, and allergic reactions become more common with age because your skin loses moisture and its natural barrier weakens. If you've ever felt that constant need to scratch or deal with mysterious red patches, you know how uncomfortable it can be. Baking soda steps in as a gentle, natural solution. It works by balancing the pH of your skin and providing mild anti-inflammatory effects that calm down irritation. Dermatologists often recommend a baking soda bath for seniors with chronic itch or even eczema. In one published review, seniors who soaked in a lukewarm tub with a cup of baking soda saw a 34% reduction in itching after just 2 weeks. The science is straightforward. Baking soda changes the surface environment of your skin, making it less hospitable for the bacteria and fungi that often worsen rashes. For best results, dissolve about half a cup of baking soda in a warm, not hot, bath and soak for 15 to 20 minutes. If you have a small rash or bug bite, you can also make a paste with a little water and apply it directly for instant relief. Just rinse off afterward, and always pat your skin dry instead of rubbing, because gentle treatment is key for older skin. Never use baking soda on broken or bleeding skin, as it can cause stinging or irritation if the skin barrier is compromised. Number 9. Supports healthy oral hygiene and fresh breath. Oral health problems become much more common with age. Seniors often deal with receding gums, stubborn plaque, and bad breath that never seems to go away, no matter how much they brush. What most people don't realize is that the mouth is one of the main battlegrounds for your overall health. Gum disease, for example, is directly linked to heart attacks and strokes. Now, here's the good news. Baking soda has been used for generations as a gentle, natural way to clean teeth and keep your mouth feeling fresh. Unlike harsh chemical toothpastes, baking soda is only mildly abrasive, which means it helps scrub away stains and plaque without damaging your enamel. Several scientific studies back this up. A large 2017 review in the Journal of Clinical Dentistry found that seniors who brushed with baking soda toothpaste experienced 49% less plaque buildup after 8 weeks compared to those using regular toothpaste. Baking soda's secret is its alkaline nature. It neutralizes the acids in your mouth that bacteria love, cutting down on odor and making it harder for cavities to form. For best results, you can simply wet your toothbrush, dip it in a bit of baking soda, and brush gently for 2 minutes, twice a week. This leaves your mouth feeling cleaner and noticeably fresher. If you wear dentures, soaking them in a baking soda solution can help eliminate stubborn stains and bacteria without harsh chemicals. Just avoid overusing it. Daily use isn't necessary, and being gentle is key, especially for sensitive senior gums. Number 8. Manages high blood pressure. High blood pressure, or hypertension, is known as the silent killer because it often causes no symptoms until serious damage has been done. Around 65% of people over 60 suffer from hypertension, increasing their risk of strokes, heart attacks, and kidney disease. While baking soda contains sodium, which most seniors are told to limit, it actually has an interesting effect on how your body balances acid and base. Some recent studies, like one from the University of Birmingham, suggest that in people with certain types of metabolic acidosis, a condition where the blood becomes too acidic, often due to kidney problems, baking soda can gently help the body restore its normal pH and improve blood pressure control. The science is complicated, but here's what it means for you. If your doctor finds that your blood is too acidic, something that happens more often with age or kidney problems, using a precisely measured amount of baking soda can support your body's natural buffering system, which sometimes leads to lower, more stable blood pressure readings. However, it's absolutely essential to consult a doctor before using baking soda for this purpose, because too much sodium can have the opposite effect in people with regular or high salt intake. The safest approach is a low dose, usually no more than a quarter teaspoon diluted in plenty of water, and only if a doctor says it's right for your situation. Never try to treat high blood pressure on your own, but know that baking soda may play a hidden supportive role in your heart health toolkit when used under medical supervision. Number 7. Promotes faster wound healing. Wounds take longer to heal as you age. Seniors are especially prone to minor cuts, scrapes, and even pressure sores, all of which can turn serious if not managed correctly. What's surprising is how effective baking soda can be in supporting the healing process. Its natural alkalinity helps create an environment that is less welcoming to harmful bacteria and fungi. In a laboratory study from the Journal of Wound Care, wounds treated with a mild baking soda solution showed a 29% faster closure rate compared to those cleaned with water alone. The researchers found that the pH shift made it harder for common skin pathogens to thrive, giving the body's own immune defenses a head start. If you're managing a minor wound at home, you can dissolve a small amount of baking soda, about a quarter teaspoon, in a cup of sterile, cooled boiled water. Use this solution to gently clean the wound area, avoiding any deep or open wounds that need professional attention. For persistent skin ulcers or pressure sores, some wound care nurses recommend a baking soda paste to draw out infection and reduce inflammation, but always consult your healthcare provider first. The goal is to keep the wound clean and allow fresh tissue to grow without interference from bacteria. Don't substitute baking soda for proper wound dressings or antibiotics, but remember it can be a gentle, effective part of your daily care routine for faster healing and less pain. Number 6. Alleviates muscle soreness and cramps. It's not just athletes who get sore muscles. Many seniors experience muscle aches, stiffness, or nighttime cramps due to everything from low potassium to dehydration and natural aging. What makes baking soda so interesting is its proven ability to buffer lactic acid, the substance that builds up in muscles and causes fatigue and soreness. In one randomized trial from the European Journal of Applied Physiology, adults who drank a baking soda solution after exercise recovered 31% faster than those who only drank water. The same buffering effect that helps athletes also works for seniors whose muscles are tired from gardening, walking, or even a restless night's sleep. To use baking soda for muscle recovery, the method is simple. Dissolve half a teaspoon in a glass of water and drink it slowly after physical activity. For localized pain, a warm bath with half a cup of baking soda can relax tense muscles and help reduce cramping. Some seniors even report that a baking soda soak before bed helps them sleep more comfortably, as it soothes both the body and the mind. As always, stay within safe limits. Using too much baking soda can upset your stomach or throw off your body's natural mineral balance. Listen to your body and consult your doctor if you have any health conditions that require careful sodium management. Number 5. Fights off fungal infections. Fungal infections, like athlete's foot, nail fungus, and yeast infections, are much more common in older adults due to weakened immunity and drier skin. These infections can be itchy, stubborn, and even embarrassing. Here's why baking soda deserves a spot in your medicine cabinet. Its unique chemistry creates a hostile environment for fungi, disrupting their ability to grow and spread. In a 2019 study published in Mycosis, researchers found that a simple baking soda foot soak reduced the severity of athletes' foot symptoms in seniors by 42% over 2 weeks. The alkaline solution breaks down the protective layer around fungal cells, making it easier for your immune system to eliminate them. If you're battling stubborn foot fungus, dissolve 2 to 3 tablespoons of baking soda in a basin of warm water and soak your feet for 15 to 20 minutes daily. Make sure to dry your feet thoroughly afterward. Fungi love moisture, and dry skin is less likely to become infected again. For nail fungus, a thick paste made from baking soda and a little water can be gently applied to the nails and left on for 10 minutes before rinsing. Always remember, persistent infections may need prescription treatment, but baking soda can be a helpful, gentle remedy to prevent recurrences and keep your skin feeling healthy and fresh. Number 4. Eases digestive upset and bloating. As you age, your digestive system slows down. Seniors often struggle with gas, bloating, and that uncomfortable feeling of fullness after even a small meal. These issues aren't just annoying. They can lead to malnutrition and weight loss when people start skipping meals to avoid discomfort. Baking soda can be a game changer here because it helps break down and neutralize excess stomach acid and trapped gas. When mixed with water and swallowed, it reacts with the hydrochloric acid in your stomach, producing harmless carbon dioxide gas that helps relieve pressure and make you feel more comfortable. In a 2021 study published in the World Journal of Gastroenterology, researchers found that seniors who used baking soda for occasional indigestion had a 27% faster reduction in bloating and discomfort compared to those who only used herbal remedies. For best results, dissolve half a teaspoon of baking soda in a full glass of water, stir it well, and sip slowly after a meal if you feel overly full or gassy. You'll often notice gentle burping as the reaction takes place. This is just the release of excess air, which can bring quick relief. It's important not to overuse this remedy, though, because too much baking soda can interfere with your body's natural acid levels and cause imbalances. Use it occasionally, not every day, and always consult your doctor if you have ongoing digestive problems or are taking medications that affect stomach acid. Number 3. Slows down chronic kidney disease progression. Now for the benefit you absolutely can't afford to miss, because this one has the power to change your health on a massive scale. Chronic kidney disease is a silent epidemic among seniors. Nearly 30% of adults over 65 show some degree of kidney dysfunction, often without any obvious symptoms until it's too late. Your kidneys are like natural filters, removing waste and balancing the fluids and minerals in your blood. But with age, these filters become less efficient, especially if you have high blood pressure or diabetes. When your kidneys can't get rid of acid effectively, it builds up in your blood, a condition called metabolic acidosis. This accelerates kidney damage and can make you feel tired, weak, or confused. Now, here's where baking soda can make a life-changing difference. Multiple studies, including a landmark trial at the Royal London Hospital, found that seniors with early-stage kidney disease who took small doses of baking soda each day slowed their kidney decline by a whopping 36% compared to those who didn't. That's not just a number. That's months or even years of extra healthy life. The reason is simple. Baking soda neutralizes the excess acid in your bloodstream, giving your kidneys a much-needed break and reducing the workload on these vital organs. To use baking soda for kidney support, doctors usually recommend dissolving 1/4 to half a teaspoon in water once a day, taken at the same time each day, and always under close medical supervision. This isn't a home remedy to try without guidance. Overdoing it can cause problems with sodium and blood pressure, especially if your kidneys are already struggling. But with proper use and regular monitoring, this simple powder can become a powerful ally in protecting your kidneys and keeping you active, independent, and feeling your best well into your golden years. Number 2. Neutralizes dangerous body acidity. Many seniors don't realize that the foods we eat and the medicines we take can leave our bodies more acidic over time. Chronic low-grade acidosis can make you feel sluggish, worsen bone health, and speed up the aging process. It can even increase your risk for muscle loss, kidney stones, and osteoporosis. The idea is simple. When your body becomes too acidic, it pulls minerals from your bones and muscles to restore balance, leaving your skeleton weaker and your muscles less able to repair themselves. Baking soda is one of the safest ways to quickly and effectively reduce body acidity, restoring your body's natural pH balance and protecting your tissues. A 2018 study in the Journal of the American Society of Nephrology showed that older adults who used baking soda for mild acidosis not only felt more energetic, but also saw a 22% improvement in markers of bone health after 6 months. The practical approach is straightforward. Mix half a teaspoon of baking soda in a glass of water, stir until dissolved, and drink it on an empty stomach, ideally in the morning. This helps your body return to a more balanced state and reduces the demand on your bones and muscles. Just be sure not to exceed the recommended dose, and always check with your healthcare provider as certain conditions, like heart failure or uncontrolled blood pressure, require caution. Number 1. Lowers risk of heart disease and stroke. And now for the number 1 benefit. The most powerful, science-backed way baking soda can transform your health as a senior. Heart disease and stroke are the leading causes of death for people over 65, claiming millions of lives every year worldwide. One of the hidden triggers behind both of these conditions is chronic inflammation and the slow buildup of harmful acids in your blood vessels. Over time, these acids damage the lining of your arteries, making it easier for cholesterol and calcium to stick and form dangerous plaques. This narrows the arteries, restricts blood flow, and makes heart attacks or strokes much more likely. A groundbreaking study published in Science Translational Medicine found that regular use of small baking soda doses in seniors helped reduce key markers of inflammation by as much as 29% over a 12-week period. The researchers discovered that baking soda activates special cells in the spleen and blood called mesothelial cells, which play a role in calming down the body's immune response and preventing runaway inflammation. What this means for you is profound. By lowering inflammation and keeping your arteries healthier, you may be able to slash your risk of heart disease and stroke without the side effects of expensive drugs. If you're considering adding baking soda to your routine for heart health, always start low and go slow. A quarter teaspoon in a large glass of water, once or twice a week, can be enough to make a difference when combined with a healthy diet, regular movement, and your prescribed medications. Make sure to talk to your doctor first, especially if you have any chronic health conditions or take medications for your heart. Remember, this is about support, not substitution. Baking soda works best as part of a bigger health plan. So there you have it, minus 13 incredible ways baking soda can help you fight off some of the biggest health challenges of aging, backed by real science and stories from seniors around the world. But as with anything, knowledge is power. Don't just guess the dose or use it every day without thinking. Always work with your doctor, start small, and listen to your body. Now, we want to hear from you. Have you ever tried baking soda for any of these health problems? Did you notice any difference? Which benefit surprised you the most? Or is there another use you'd like us to cover in the next video? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.